So welcome everybody to Now Suffolk. This is our second event of 2022, and I'm very happy that you're all here for this very important conversation that we're going to have with Lauren Lamagna. So before we get started, I just have a few announcements to make. I attended the Now New York State Council meeting, and it was really interesting because there was so much that was discussed, and I still need to, make some time for myself. Hopefully this weekend to put everything together into a document and send it to all of you. But in the meanwhile, you can look at the Now New York website, and that has all the events of all the chapters. And that's really important because that way we can think of how we can co sponsor events with other chapters and we can have more conversation with the other chapters. So I think it's a great idea if all of us can actually look at the Now New York website and look at other events that are posted there. And Sonia Zario, actually said that she would post our session too over there so that other chapters can see what we're doing. And then the other important announcement, at which I think Juliet Gobler might have sent to all of you, is about the Equality Amendment. And the lobbying is going to have, there's going to be lobbying on May 10th in Albany. So those of you who want to join on that, go on the bus to Albany. You can go on the Facebook page Now Suffolk and look at the links for details about that, and also to find more details about the Equality Amendment. Susan Hindley kindly sent me some documents about the Equality Amendment, which I will also post on Facebook, if that's okay, Susan. And so that way you can get more of an understanding what that amendment involves. So once you have an idea about that, I think you can make a decision whether you want to go on May 10th to Albany. But besides that, there are so many events happening in all the other chapters, so I don't want to take up too much time listing all of them. But each chapter is doing really interesting work on the state level. So today's discussion is really, really important. It's something that really brings us face to face with the precarity of, women's decision making regarding their reproductive rights. So Roe v. Wade was a landmark 1973 ruling, which brought reprieve to American women after the dark years of the 1950s and 60s. But over the last many years, and especially the last few years, we've seen a multitude of bills across the country to restrict abortion access and abortions, right from parental consent laws to waiting period to doctor access. So these have resulted in severely curtailing Roe, with abortions being illegal in states like North Dakota, Texas, and now Oklahoma, and soon, in Mississippi. Many state legislatures are waiting their turn to restrict abortion access. So we are watching the Mississippi case in May, and that will really show us what the Supreme Court decision is, and that could be like the linchpin, towards our, foreseeing what's going to happen if Roe is decimated. Even if we think that abortion pills like RU 487 provide safe harbor, restrictions apply to these as well. So leaving women with no choice. So today we are having Lauren Lamagna, and she's going to talk about sexual and reproductive healthcare in the US, the future of sexual and reproductive healthcare, what can be done at the legislative level. How does Planned Parenthood see itself positioned to provide access to all communities in light of the changing landscape of restrictions? Can states with more access help states with least access? What can each of us do to open up avenues to care? So just a little bit of introduction to Lauren Lamagna. They work as the public affairs manager at Planned Parenthood Hudson Peconic, beginning their journey as a sexual and reproductive health rights advocate. As a volunteer with PPHP almost 10 years ago, Lauren has worked in various facets of social justice advocacy with a strong foundation and belief in reproductive freedom. Lauren is also a licensed master in social work, specialized in social and political advocacy, and is an adjunct instructor at the Stony Brook University School of Social Welfare for the macro social work track. So, welcome, Lauren. We are eager to hear from you, and let me make you co host.
Thank you so much for having me. Um, there's so much to talk about, and I was trying to find a way to facilitate these conversations and have it all kind of flow and make sense. So I'm going to do my best to cover as much as we can in this time together. I'm definitely somebody who enjoys conversation throughout. So if you have any questions or thoughts or anything like that, please feel free to either type them in the chat, like physically raise your hand so I can see your face, or use a reaction or something so I can see that somebody would like to come off mute and share with the group. So thank you again. So I'm going to see if I can share my screen. Beautiful. Okay, and we're gonna go to slideshow and we're gonna go to present from the beginning. Amazing. Okay, so again, my name is Lauren. I use they and she pronouns. I am the public affairs manager at Planned Parenthood Hudson-Peconic. I don't have to do my entire introduction because it was already done for me. Thank you so much. I forgot that I sent that over. I'm going to be talking about the landscape of sexual and reproductive health and rights as it exists right now. Let me tell you that I was on the computer about an hour, around 10 o'clock, 10:30, checking my email to make sure that there weren't any further updates that I needed to update my presentation, because really the landscape is changing day by day. There are bills and legislation being passed across the country in various states that are impacting access to reproductive health every single day. So I wanted to make sure I had at least as the most up-to-date information as I possibly could. But please know that because things are changing so quickly, I might not have the answers for you right now. But if there's any questions that you ask throughout the presentation, I have no shame in telling you that I don't know the answer, but I will find the answer for you and we'll send it along. But before we kind of get started, I did want to do a quick level set on our affiliate as a whole. A lot of the times when I'm out in the community and I say I'm from Planned Parenthood Hudson-Peconic, they're like, Hudson, why are you in Suffolk County? And so I just like to give a little bit of an overview of our affiliate as a whole. So Planned Parenthood Hudson-Peconic is the Planned Parenthood healthcare provider that covers Suffolk County and then Westchester, Rockland, and Putnam. We have a total of 10 health centers that provide comprehensive sexual and reproductive health care. We also have two amazing mobile health centers that are able to go into the communities that might not be able to access our physical health centers and be able to provide a wide range of our healthcare services through telehealth, which is a really amazing thing that technology can do for us. So what do I mean about comprehensive sexual and reproductive health care? Here's a list of all of the things, or at least some of the things that we provide, right? Comprehensive healthcare means annual gynecological visits, birth control, cancer screenings, pregnancy testing and counseling. We provide prenatal care. We provide both medication and in-clinic procedure abortion care, STI testing and treatment, HIV testing and treatment, PrEP and PEP, gender-affirming care, hormone replacement therapy for our queer, transgender, non-binary folks, anybody who is looking for that affirmation. We provide the HPV vaccine, and one of our newest health care services is vasectomy services. In addition to our healthcare, we also have a really amazing education and training team that does community education, school-based education, professional development, and parent education sessions so that parents, caregivers of young people, whoever those role models are in our young people's lives, have the skills that they need in order to educate the young people in their lives about their bodies and their sexual and reproductive futures. In addition to our healthcare team and our education team, We have the public affairs team. So that's myself, my boss, Trisha, and two amazing community organizers who really focus on educating the community about legislative issues, issues of how sexual and reproductive health care access intersect with a lot of other movements and identities, whether it be race, immigration, gender, class, and socioeconomic status, things like that. So that is we have a lot of things we do in the public affairs department, both with the community and our elected officials on a local, state, and federal level. Planned Parenthood Hearts of the Conic provided services to over 31,000 patients last year with over 56,000 visits, many of them which were telehealth. And we had, over 5,000 people reached over through our education programs. Our patient relations call center, which is our centralized call unit, who is an incredible team and able to provide so much caring guidance to folks trying to come to Planned Parenthood for care. They're the ones that make all the appointments and send people where they need to go to their closest health center. They are a very, very core part of our team. Took over 151,000 calls last year. And we had over 31,000 Planned Parenthood activists, which were ready to mobilize and advocate for sexual and reproductive rights. So our team is huge. Our reach is huge. Our investment, our commitment, and people who are committed to us is a very, very large number, which is amazing. We also have I like to show our patient demographics. Sometimes there is an assumption of who comes to Planned Parenthood and who comes to get care at Planned Parenthood. So I like to give the data. Our patients are diverse. Our patients are diverse in age and in race and in socioeconomic income. We do see a lot of folks who do fall below the poverty line because we do provide care regardless of people's ability to pay. But there are people who have health insurance who do have the ability to pay and come to us for care because we provide such high quality care. So I do like to show the patient demographics to kind of get an overview of who comes to Planned Parenthood. And the answer is everybody can come to Planned Parenthood. All right, I'm actually going to stop sharing my screen briefly or pause sharing my screen. I don't know if that actually works. Can folks still see my screen? Is that something that you can see? Okay, I'm going to actually stop sharing. There we go. I'm going to do that instead. So before I get started and kind of level setting what the policies are or what's going on in the nation, I do want to open the space to anybody who'd be interested or wanting to share their own personal experiences with accessing sexual and reproductive health care, or just why Planned Parenthood or why sexual and reproductive health care matters to you, why you came to this meeting today, what are you looking to get out of it? Just want to see who's in the space with us today. Ethel, I see your hand up.
Yeah, I just want to say I'm not from Suffolk County anymore. I was a member of Huntington Now long time ago. I live in Cincinnati now in Ohio, and we have, big problem here in Ohio now, of course. But I just wanted to tune in and see if anybody is there still a Huntington chapter? I really don't even think so. And it's just nice to see all these young people, involved in everything. And thank you, because I think we're going to need the resources coming in from New York State, looking into the future. And we do have a small chapter here in Cincinnati and Ohio. It's pretty dead. I mean, we're just losing terribly, but be aware that we're here, and thank you for being involved.
Oh, no, thank you. And thank you for joining from Ohio.
Yeah. I don't know if you remember any of, Abby Parisa, she's probably still around. Yeah. Yep. And Marilyn Fitterman, who was president of Suffolk Now years ago. I was once president of Huntington Now back in the 1970s, it was. And Ruth Brandwine. I mean, we're still around, a lot of us that were from the old days. And unfortunately, we just lost one of our old members. So anyway, but be aware that, we're going to have to be in touch at times. So thank you.
Absolutely. And thank you for all of your work and advocacy. I think you raise your experience in and of itself shows that this movement is an intergenerational movement, and we can lean on each other, and we are standing on the shoulders of people like you. And, we are just going to continue moving forward, and together, that, and our collective knowledge is how we're going to get through the next, chapter in what
The
future
important
be.
thing is, where we're going to need some help in a lot of the states is to elect the senators. And, if you have friends in Ohio, please urge them to vote for Tim Ryan for the Senate, your friends in Ohio, for Tim Ryan for the Senate. And, hopefully he'll win the, and, in Arizona, there are Mark Kelly, whatever support people on our side can get from outside. If you have friends living in Arizona or Ohio, or please, contact them, make sure they vote.
You actually raise a really good point. I want to make it very clear that I'm coming to this conversation as Planned Parenthood Hudson Peconic. We are a 501c3 nonprofit healthcare organization. So I'm actually not going to be talking about elected officials. I'm not going to be talking about elections, because Planned Parenthood Hudson Peconic, the healthcare organization, does not get involved in those things. However, what I am allowed to talk about is how healthcare policy impacts access to care. So that's going to be my focus of the conversation. I just want to make it very, very
But everybody
clear.
listening, thank you.
No problem. Thank you. Judy, I saw your hand up. Oh no, I think you're muted.
Oh, there we go. How's that?
Perfect.
Great. I'm Judy Polson from New York City now. And you were asking what brought us here and what our experiences had been. I'm very fortunate. My parents insisted that I go to college, and I got corporate jobs after that. So I've always had very decent health insurance. I mean, the pill wasn't covered or whatever, but I was certainly able to get gynecological reproductive health care when I needed it. But I've always been acutely aware that that is not true for everyone. And that's been my interest, and my driver is to try to make sure that other women have the access that I had. And I've done clinic defense, I've done lobbying and things like that. So very, very glad to have Planned Parenthood driving this so hard.
Thank you so much. Joshri, I see your hand up too. And please correct me if I mispronounced your name.
My name is Jayashri.
Jayashri.
And I'm Pramila's sister. The story that I bring to you is my experience of when I became pregnant in my 40s. I used to live in Kansas, and until I moved to Kansas, the doctors had told me that I would never have children because they deemed that my husband and I were infertile in one form or another. And so when I got pregnant, I was in Kansas, and suddenly feeling quite alone and without community. And on the one hand, the prospect of becoming pregnant was, truly a miracle. But what followed shortly is that I became pregnant just as I turned 43. And with that came, kind of like a little bit of doom, that I was at a higher age bracket, lot more propensity for complications, birth defects, etc. So the idea of testing became quite fraught for me. At the time, I was also back in school trying to get a master's degree, and I was caught between two communities. On the one hand, because I was in Kansas and because I was in school, there were these voices of the conservative community, the Mormon community, that said to me, "Oh, you're going to have testings now. Are you sure? You better keep the child, right? You're going to keep the child." In just this expression, there was a lot of agitation about what decision I would make. And then on the other hand, I had acquaintances come out of the woodwork, people I had never talked to, who visited me at home and said to me, one of whom was a medical doctor, who said to me, well, you're definitely getting an amnio, right? You need to get an amnio because you don't want to have any room for birth defects. And you should, in fact, get tested so that you'll have access to abortion. I mean, the journey between being pregnant, getting tested, and getting an abortion was like just such a through line. And and in that hormonal state, I was only 5 weeks along. I had just learned that I had gotten pregnant. Um, I was suddenly, despite my educational level, was unable to think. And so I went to the doctor, my gynecologist, and said to him that, what was going on with me, and that I was unable to think. And even now, saying this story, I'm, back in that same emotional state of mind. And he said to me something really helpful at that time. And he said, Jayashree, whatever decision you make is the right decision. And with that, we started to work together about my health, the particular context of my health, and what would be helpful or not helpful for me. And we just worked through the decisions step by step. And so I decided not to have an amnio and went for a different test because I had become pregnant against all odds. And so that worked for me. It wouldn't work for everybody else, but what it also brought in touch for me is, people are so interested in protecting their own morality, and I don't have any room to and time and space to get in touch with my morality, and I felt like, and the other thing is, I also realized in that moment how little, when people say you should definitely keep the baby. Yeah, and is that we don't talk enough about the policies that help families when things fall apart. That's when we need these policies so that we can make up our minds, make the choices that fit each of our stories, and have support when things don't go right. So I would have so loved to have this group and this community at that time. So many years ago. My daughter is now 12. And I'm so grateful that we are meeting, grateful for now. I was never a Now chapter member. It's because of Pramila's influence that I'm even here. I need to find a Now. I now live in Illinois and need to find a Now chapter here that I can belong to. So thank you so much for listening to my story and giving me a chance to speak.
Thank you so much for being vulnerable with us, especially as a new face to the group. Thank you for wanting to share your story with us. And I think for me, the thing that really sticks out to me is, regardless of what decision you made, it was supposed to be yours under the guidance of your doctor, right? Like nobody else should have made that decision for you. Also, people are so concerned with their own morality that I couldn't even think about mine, right? Like
yeah, we're in Illinois. Chicago, we're having our conference. So it should be easy to contact somebody, at least in the Chicago area.
Yes, thank you, Ethel. But yeah, so the idea that people are worried about others and putting their personal beliefs on others, rather than just thinking about what they would do for themselves, right? And that's what these policies and access to healthcare are about. It's, I'm not telling you what to do with your body. Don't tell me what to do with mine, right? So thank you so much for sharing that. I really appreciate your vulnerability. And I think that actually is a great place for us to kind of start kind of level setting just about people's, as a whole, like what are the thoughts around abortion access, right? What does everybody feel about abortion access? So I'm actually going to share my screen again, and we're going to kind of get into this level setting. Do you see a big slide on your screen? Great. Okay, so I just want to go over some facts about abortion. We want to make sure that we as a group are kind of understanding where we are now and try to correct some misinformation that has been floating around. So according to data, 80% of Americans want abortion to be legal. And that is majority of Americans, regardless of political party, right? That is just Americans as a whole. More than 1,300 restrictions have been placed on abortion since the passing of Roe v. Wade in 1953. And 600 abortion bans have been introduced, with over 100 put into law in 2021. So that is information from last year. And then 529 abortion bans have been introduced in 41 states in 2022. And this statistic is probably outdated by now. Right? This statistic is going to be outdated, almost every day, because we're seeing abortion bans be introduced in states on a daily or weekly basis. The other important thing that I want to say is that legality to, or legal access to abortion does not always equate to people being able to access their abortion care. We're going to talk a little bit more about that further on, but I just want to kind of say that at the upfront. Something that I've learned in my kind of advocacy around what is happening across the country is that I find that a lot of folks don't really, I assume that folks know what Roe v. Wade is and the history of Roe v. Wade, and that is not actually a safe assumption to make. So I'm sure that many folks on this call know Roe v. Wade, but I do like to give a little bit of like a historical context. So Roe v. Wade was passed in 1973, which protected a person's right to abortion, actually under a clause around privacy, which is something that a lot of folks don't know. It was determined that the due process clause of the 14th Amendment protected a woman's right to abortion, but under certain limitations, right? So it was decided that abortion could not be banned in the first trimester, but could be regulated in the second trimester and could be banned in the third trimester. So that's really important to know kind of how we've got to this point. There was a case in 1992 that was Planned Parenthood versus Casey. And so now this court case upheld the right to abortion that was established in Roe v. Wade. It altered the standard for analyzing restrictions, making sure that abortion ban, like any sort of state law that was banning abortion, could not create an undue burden. So laws could not be created that would make it inaccessible because of red tape, or would put people in even more stressful situations trying to receive their abortion care. The tough thing about that is that that's hard to prove, unfortunately, and that's kind of what we're seeing now. It also overturned Roe's trimester framework, and so we moved to viability and weeks. And that's why we're seeing 15-week bans or 6-week bans or 20-week bans rather than ideas around trimester. But what's happening right now, right? What is the Supreme Court case that is being reviewed by our current Supreme Court? It is Jackson Women's Health Organization versus Dobbs. That's the one that's currently being debated. This case is arguing whether putting a 6-week ban on all elective abortions is unconstitutional. And what makes this different is that the Mississippi lawmakers specifically asked the court to overturn Roe v. Wade. That's where we are right now. And so with the Supreme Court case in the position that it is, we're seeing so many states getting ready and passing abortion legislation with the anticipation that the court potentially could overturn Roe v. Wade. So what are the most recent things that have happened? This is the slide that I was updating this morning because we got information yesterday about something that happened in Oklahoma. So Oklahoma has been very busy. They had passed House Bill 1503, which is an SB 8 copycat bill with an emergency clause. That's very jargony, so I'm going to break it down. As folks may or may not know, Texas passed a law last year called Senate Bill 8, which banned abortion and then put a bounty on people, right? People are allowed to, citizens are allowed to sue anybody who receives an abortion, helps that person receive an abortion for, I believe it's $10,000. They can sue in civil court. So Oklahoma passed a copycat bill, and the emergency clause means that it would be effective immediately after the governor signs it. So now the governor, it's heading to the governor. They also passed another trigger ban. They passed a Senate bill that made it making it a felony to perform an abortion with a fine up to 10 years in prison and a $100,000 fine. So Oklahoma's been busy. Kentucky also passed a anti-abortion omnibus law, which just means it has a lot of components to it that effectively bans abortion in the entire state. Idaho passed a six-week ban with SB 8 lawsuit possibilities. Also, Ohio has also been busy. Same thing with Florida. So there's been a lot that's been going on, and so what I like to unfortunately talk about is that with the Supreme Court case, there are many different outcomes that could there's multiple outcomes that could happen. And to be frank, none of them are good. We are preparing for what we're calling bad, badder, and baddest. And so what that essentially means is the Supreme Court could allow Mississippi's current 15-week ban to be in place, but not directly overturn Roe v. Wade. And what that means is that this kind of opens the door for other states to implement similar bans to abortion care, and open the gate a little bit more for more cases to move to the Supreme Court level to start slowly chipping away at the protections that Roe v. Wade provided, all the way to the kind of the worst possible outcome is that not only is Mississippi's 15-week ban allowed to stay in place, they completely overturn Roe v. Wade, which would make it so that access to abortion is not federally protected and is purely determined on a state-by-state basis. So what could what we're calling a post-Roe world look like? This map is actually an interactive map. It's obviously not interactive on this slide because it's a screenshot, but it's from the Guttmacher Institute, which is an amazing research organization that looks at access to sexual and reproductive healthcare. And so if you are interested in kind of poking around on this map, we'll go to the Guttmacher Institute. And so what you're seeing is that the states in orange are the states that could potentially be banning abortion care, either very, very severely or entirely. What you see is a good swath of the country. The light blue states are the states that are protecting access to care in some way, shape, or form, or across the spectrum. And those are the states that people are going to need to travel to in order to receive the care that they need. What we're seeing is that people need to do this already, right? This is not something that is completely new, because we know that access to abortion legally does not mean access to abortion in practice. And so specifically at Planned Parenthood Hudson-Peconic, we have had patients come from Texas. We've had patients come from other states. And so the question of what does the Supreme Court case and the decision of the Supreme Court mean for access to care? It means that people who had access might be experiencing more challenges to receiving the care that they need. And then the people who are already having challenges accessing their abortion care are going to have even more challenges accessing their abortion care. And what we do know is that does not look the same for everybody. Folks of low income, Black, Indigenous, and other folks of color who are able to get pregnant, gender nonconforming and queer people who are able to get pregnant, folks of low income, those who have different immigration statuses, right? Like the abortion bans disproportionately impact those folks. And so those folks already are experiencing challenges accessing the care that they need. And it's just going to be even more difficult for them. Right? So like keeping abortion legal is extremely, extremely important. But these laws don't necessarily make abortion accessible. And so people with power over policies, it's a lot of P's in that beginning sentence, people with power over policies have the ability to defund certain programs and place restrictions on abortions that are still considered legal despite their limitations. And so, you know, abortion may legally be allowed in certain areas, but if it's inaccessible, legality doesn't help, right? What does that mean for New York? Which is a really great, I forgot, man, my slide progression, I was prepared today. So abortion care in New York, back in 2019, we were able to pass the Reproductive Health Act. What did that do? It codified Roe v. Wade protections in New York State. Why is that important? That's important because New York actually passed legal abortion in 1970, so 3 years prior to Roe v. Wade passing. So what does that mean? It means that the abortion laws that were on the books in New York State were actually really outdated. So New York has been following the Roe v. Wade protections, but if Roe v. Wade is overturned, we would be returned back to the 1970 laws, which had language around who could provide care, which is also outdated. A lot of the medical professions that we have now, like nurse practitioners, physician's assistants, those professions didn't exist in 1970, just because the nature of medicine changes, right? So the who could provide abortions was outdated. The abortion rights was in the criminal code and not the health code because abortion was not federally legal at the time. So what we needed to do is we needed to update our New York State law and our abortion protections in New York State. And that's what the Reproductive Health Act did, right? It moved the abortion laws from the criminal code to the health code where it belongs because abortion is healthcare. It updated who is able to provide abortions to include professions where this would be in their medical practice and under their scope of practice, including physician's assistants and nurse practitioners. And there was one other thing. There was three main things, and I honestly can't remember the third. Essentially, what you need to know is that it updated New York State's law to mirror the protections that Roe v. Wade have in place. We also have minors' rights in New York, which impacts abortion care. What is minors' rights? Minors' rights is that minors, so young people before the age of 18, have the right to access sexual and reproductive health care without parental consent, which is extremely important in our public health statistics and our community health as a whole, but specifically the health of young people. We know that sexual and reproductive health care can be a very personal decision, and sometimes parents or guardians unintentionally could potentially limit the care that young people need in order to make the best decisions about their bodies. And so New York has minors' rights, which is amazing for specifically access to abortion for young people. And then Medicaid coverage in New York. New York State Medicaid does cover abortion care, which is not the same in every state. But there are other barriers that can exist, right? There are still transportation barriers. For us who live in Suffolk County, we know that public transportation is atrocious. So like, what does public transportation or the lack thereof, what does that mean for people trying to get to our health centers in order to get the care that they need? What does it mean to not be able to take off of work if you work an hourly wage job and don't necessarily have sick days, and somebody needs to come for care? How are they going to get to our health centers? A majority of people who receive abortion care are already parents. So what does childcare look like? What does the loss of wages look like? And things like that. So while access to care in New York is a lot better than other states, it's not always perfect because of the other identities that people hold and the experiences that people have. Now, how will access change in New York after the SCOTUS decision? That's a really complicated question, because legally in New York, nothing will change as of right now, right? New York had updated their laws with the Reproductive Health Act. So if Roe v. Wade were to be overturned, New York State would still operate under Roe v. Wade protections. But I'm actually going to go back to the map. But what access could change because of the change in access to other states. It's what I'm like unofficially calling the domino effect. So we're going to use Ohio and West Virginia as examples. So if folks in Ohio and West Virginia are not able to access care anymore in their state, they have to go to states where they can access care. So many of them might travel to Pennsylvania. And so now providers in Pennsylvania are now going to be responsible for taking care of people who live in Pennsylvania and also people who live in Ohio and West Virginia. There's only so many days in a week. There's only so many appointments in a day. There's only so many providers in an area. And so if providers in Pennsylvania are now serving also folks in Ohio and West Virginia, there might be people in Pennsylvania who would go to their local Planned Parenthood or their local private abortion provider, and they might say, I'm sorry, we don't have any appointments. So now people from Pennsylvania are going to have to travel to New York, right? That's what I'm calling the domino effect. Again, this is all kind of heady and hypothetical, and I don't think it's unrealistic. So while legal access to abortion in New York State might not see the changes that other states are seeing because of the Supreme Court decision, it doesn't mean that access in practice will not change. So what does that mean? What does that mean? What does that mean for us in New York? What can we do? And this is where I'm going to but before I segue into talking about the Equality Amendment, and I'm so happy that you mentioned it in the beginning. I was like, oh, good, we're going to talk about it. Does anybody have any questions or thoughts? I'm going to stop sharing my screen right now. Any questions or thoughts of things that I just shared about what's kind of happening on the larger scale? I know it was a lot of information, but it was also very broad because I know our time together is limited.
Lauren, this is fantastic. So there are some questions in the chat.
Perfect.
And I think other people have also jumped in, so they've answered some questions. Can telehealth be used to extend healthcare to states with least access to sexual and reproductive healthcare?
That's a really good question. And that's actually a question that I also have, because there are laws that are in place that impact where a practitioner can practice, right? So just because a medical provider is allowed to practice in New York, they might not be permitted to provide, they might not be licensed in Ohio. So if a patient is in Ohio, but the provider is in New York, is that allowed to happen? So that is something that is being talked about, but there's a lot of legal red tape that I'm not a lawyer, I'm not a doctor, but I know that those are barriers that also exist because of medical, professional laws.
Yeah, because the current thing about imprisoning women who access abortions and, get fined, I mean, all of those, I'm wondering whether it also impacts them if they travel to another state, and if providers will be fined, even if they are from a different state where legally they're allowed to provide. If other states can override neighboring state laws. Yeah.
So providers can't travel from state to state to provide care unless they are allowed to provide
Right,
care
right.
in those states. What we are seeing is some state legislatures are introducing policy that would punish individuals from going to another state to get the care that they need. Now that is something that is unconstitutional. Like it is unconstitutional. You are allowed to move from state to state. You are allowed to travel. You are allowed to visit other states. And so that is really going to be difficult, one, to like manage from a legal perspective, like the ability to enforce, that's the word I'm looking for, the ability to enforce that policy is going to be very, very difficult.
Okay.
But that doesn't stop people from introducing those policies to instill fear and uncertainty, right? A lot of the times that what we're seeing is these laws are blatantly unconstitutional, or so we thought, right? We were actually really surprised when the Supreme Court took up this case, because we were like, we've already decided that 15-week abortion bans are unconstitutional. Like, what makes this different? And so what we're seeing, and very similar to the Texas SB 8 legislation that allows, you know, citizens to sue people in civil court. It is happening. It is difficult to enforce. So we have to ask ourselves, how much of this is a fear tactic to just create fear and confusion for people about what is allowed, what is available to them, how do they get care, which is why it is so important for our providers, Planned Parenthood providers, private abortion providers, and any sexual reproductive health care kind of advocate to try to understand what is legal, what is not legal, what are we allowed to do, what are we not allowed to do, how do we support. And because things are changing so quickly, it is really challenging to kind of keep up with the things that are happening on a day-to-day basis. Juliet, I see your hand. I also see you blowing up the chat, so like, thank you. I like can't pay attention to
some things I can answer. Some things I can't. But as a group, I think we're all kind of can cover each other's bases. But I mean, I guess what's interesting and sort of piggybacking on or continuing what you're saying, though, even if these state laws are unconstitutional, the issue is that, you know, if you're pregnant, you only have a certain time period in which you can go access this. So if you know, it takes, you know, if it takes more than that, you know, few weeks or few months window that you're, you know, that you can get an abortion for your state's law to be struck down, well, it's too late. So this is sort of this interesting situation in which, you know, unfortunately, there's like a time clock for the people who have to deal with these unconstitutional laws in the meantime that shouldn't be in existence to begin with. So that's why, unfortunately, they're effective and why they're probably they're going to continue to be passed and struck down and passed and struck down. It's just, like you said, it's a fear tactic and unfortunately somewhat effective.
Which is why I think when we talk about Planned Parenthood v. Casey, you know, saying that abortion bans cannot have an undue burden on the person trying to receive the care, but we're still seeing states allowed to do 24-hour waiting periods, 48-hour waiting periods, 72-hour waiting periods under the guise of we're trying to protect that person's health, when we know that that is not the case, and that does create additional barriers. Because if you are somebody who lives in a state and your closest abortion provider is 4 hours away, you have to drive 4 hours to your provider, have the meeting, drive back for 4 hours, wait another 72 hours, drive back 4 hours, right? If you don't have the money to get a hotel for a couple of days, or what does childcare look like? What is your ability to take off work? You know, all these things kind of compile onto each other. That makes abortion very, very difficult for some folks. Jayshree.
I think that's exactly what my experience was, that even though I had access, but the Kansas law was not entirely clear to me, because I never had to think about it before I got pregnant, because I never thought I would get pregnant. And what happened was, it was at 6 weeks, you could get to know about the viability of the fetus. And then before 8 or 10 weeks, I had to make a decision. And it's an extremely short period of time, because then I have to decide whether I want to get testing in order to make a sound decision. And then where will I find a clinic? Because now I just saw on Guttmacher Institute, 98% of clinics in Kansas, um, um, 98% of counties in Kansas do not have a clinic. And 61% of Kansas women live in those counties. So, and also there is in Kansas, they are designed to discourage, they have give counseling to discourage abortion, and you have to wait 24 hours before you make a decision. So that is true for anyone, whether you have health insurance or not, and health insurance does not cover abortion. So the odds are packed, even though there might be a law on the books, the way it's enacted is a different story.
Yes, exactly. And we also see kind of that access problem in New York too, right? There are rural parts of New York that do not have an abortion provider very close. There are folks who don't have health insurance, or for some reason don't want to use their health insurance because maybe they are experiencing a situation where they feel like they can't tell their partner or the people in their lives, right? Or their caregivers or their parents, right? So not only do I make this decision, how do I make this decision? How do I pay for it? Whether do I go insurance or do I go self-pay? That's expensive. Like, there's a lot of things to consider. There are a lot of things to consider. And there's a lot of different factors that impact people's access. I am really trying to be mindful of time. And so what I do want to talk about is kind of what New York's next step is. And I'm happy to stay on as long as possible, but I know that other people probably have things to do. So I want to get through as much of the presentation part as possible, and then I can hang out and we can chat. And so what is kind of New York's next step in protecting abortion access? We already passed the Reproductive Health Act, but there's always more that can be done from a policy perspective. And so this is where we're going to talk about the Equality Amendment. And so the Equality Amendment is an amendment to change New York State's constitution to expand the definition of who is protected from discrimination. And under that, pregnancy and pregnancy outcomes are explicitly named, because pregnancy discrimination does not currently violate New York state or federal constitutions. And so pregnant people across the country are increasingly faced with criminal and civil consequences for their pregnancy and pregnancy outcomes, including New York. And so there are legal consequences, can result from stillbirths or pregnancy loss, neonatal death, or abortion. I wanted to share a couple of statistics with you that show kind of how severe this problem has become. So between 1973 and 2005, there were at least 413 cases of which a person's pregnancy or pregnancy outcome was a determinative factor in her loss or in their loss of liberty. Between 2006 and 2021, that number tripled to 2,100. So within 15 years, within 15 years, that number tripled. And so between 1973 and 2005, of pregnant people arrested, 52% were Black and 41% were low income, showing that this type of discrimination is connected to other marginalized groups, and Black and low income people are most vulnerable. And so these are, I want to share some headlines from recent years that kind of illustrate the persecution of pregnant people and their pregnancy outcomes. People have been targeted by law enforcement for eating poppy seed cake, experiencing pregnancy loss, committing suicide, suffering from drug addiction, which we know is, we know that drug addiction and substance use is a health concern, is a mental health concern. And an Alabama woman was even charged with the loss of her pregnancy because she got into a verbal altercation and she was the victim of a shooting, but because she was in the altercation, it was her fault. I want to let that sit for a minute. We know that many anti-abortion policymakers and activists aren't stopping at abortion. It is very clear that abortion has been attacked and restricted, and we've also seen the rise of targeting people for their pregnancy outcomes as a whole. And so what the Equality Amendment would do, and why Planned Parenthood cares, why we are invested in this fight, amongst other reasons, right? Obviously, we want to make sure that people are protected against discrimination based on their race, and disability status, or gender and sex, and gender identity, and all those things. The Equality Amendment would make it so that the law is explicitly clear that that persecuting pregnant people for their pregnancy or their outcome of their pregnancy is sex discrimination under the New York State Constitution. So that is a very, very brief synopsis of what the Equality Amendment is, and more so kind of how it relates to this conversation around abortion access, and why this is New York's kind of next step in protecting access to abortion care. Other state and local policies that we are kind of working on that are related to abortion care, but also pregnancy and reproductive health in general. We are trying to pass an abortion access fund, which would create tax season just happened. When you do your state taxes, there's that section where they say, do you want to donate a portion of your state tax return to, I think there's a list of like 21 causes. I think Leukemia Society is on there, breast cancer awareness is on there. This abortion access fund legislation would create a statewide abortion access fund that people could donate a portion of their state tax return, so that providers like Planned Parenthood could receive grant funding and be able to support patients in order to pay for their abortion care. Now, there's already the New York Abortion Access Fund, and I'm going to do a little plug for local abortion funds at the end. The New York Abortion Access Fund is a grassroots volunteer-led abortion fund, and that is not going away, and local abortion funds are so important in thinking about access to care. This would not replace that. This would be an addition. This abortion access fund would be specifically for providers, while the New York Abortion Access Fund is for patients. So not replacing, we need both. We're also advocating for comprehensive sex education. If people don't have the knowledge about their bodies and healthy relationships and have common language, if we don't all have the same information, we are not able to make the best decisions for ourselves and the healthcare that we need. And so thank you so much, Dishi, for spending your time with us and for sharing your story. I really appreciate you being here with us. And I'm sorry we're going over time, but thank you for being able to join us. So comprehensive sex education would make all public and charter schools be required to provide comprehensive, medically accurate, and inclusive sex education, kindergarten through 12th grade. We know that that is an effective way to make sure that all young people are getting the information that they need. I will answer a question that I get a lot. No, we are not teaching about sex to kindergartners. I like to say you wouldn't throw a kid in calculus without teaching them their 1, 2, 3s first. Comprehensive sex education works the same way. In the very, very young grades, we're talking about consent, but in a way that makes sense to them, right? Do you want to go hold your friend's hand? You want to borrow that pencil? Did you ask first? And making things very appropriate for that age group. We're teaching people the proper names for body parts so that everybody has a shared language, so that as people get older, we're able to have more constructive conversations. When I hear a lot of stories about people's sex education experiences, they say, to be honest, I couldn't even pay attention in my middle school health education, even when we were talking about sex, because they would say penis and everybody would laugh, right? So like, that is a distraction from the actual education, because it creates this like stigma around a medically accurate term for a body part, right? So having people have the same language, the accurate language, and how to talk about their bodies, one, allows for people to have a common language. So when relationships do get complex and they do get intimate, we have a unified language of what we want and what we're talking about, and also allows young people the tools that they need to advocate for themselves within a medical professional setting, right? they're able to go to their doctors as young people, as young adults, and be able to say, this is like, I'm going to talk about this part of my body, and not be ashamed of that, right? So comprehensive sex education is very complex. It involves healthy relationships. It involves conversations about body image, anti-bullying. And so that as a whole curriculum and as a whole initiative does impact access to healthcare. We're advocating for policies to address the Black maternal health crisis. We know that Black women and Black people who are able to get pregnant are disproportionately affected by maternal morbidity outcomes related to their pregnancies and to their childbirth. And so making sure that we're addressing that not just on a societal level and like a cultural level, but from a policy perspective. And then continued funding for sexual and reproductive health care programs, making sure that our family planning grant is fully funded so that providers of sexual reproductive health care are able to provide that service either at free or low cost so that people can come see providers regardless of their ability to pay. And obviously we're continuing to support our community partners. And this is where I'm gonna plug our local abortion access funds. As we talked about a lot during our time together, is that access does not just rely on the legal right to access care. And a lot of the barriers do come from funding and money and people's ability to pay, people's ability to travel. And local abortion funds are really filling a gap that exists. And so the more that we see abortion rights being restricted, the more that people are going to have to be traveling, and the more expensive it's going to be for people to receive the care that they need. So if you are able to not only support organizations like Planned Parenthood who provide care, but if you are able to support your local abortion fund, other states' local abortion funds, so that they are able to support the people that call their hotlines and say, I need to get to New York and I don't have the money to do so. That is going to be a very, very important part of how we get people access to care, is this kind of like mutual aid effort moving forward. Okay. Any questions before I talk about actions that you can take? We talked about so much today.
I think Judy had a question on chat.
On the chat. Let me pull that up.
Non-surgical, yeah.
Some of our younger activists aren't too worried about Roe because the availability of non-surgical abortion options, also known as medication abortion. Can you speak to that, please? Absolutely. I don't necessarily, I also would argue that it's not just younger activists aren't worried. I feel like a lot of folks aren't worried because they're not aware of what's happening or, you know, the impacts of it. I feel like sometimes, you know, sexual and reproductive healthcare advocacy is like my life, right? It's my job. I'm surrounded by it all the time. And I assume that other people know what's happening too. And that's what happens when we kind of like get into our own little bubbles. And that could be said about any issue, right? I'm sure that our immigrant rights organizational partners can come to me and be like, did you know this was happening? I could be like, I had no idea. They're like, how do you not know about this, right? We're all kind of like in our own little bubble sometimes. I would say that with the ability to receive medication abortion and medication abortion as an option for people is really fantastic, right? It is a way that we increase access to abortion care because there's multiple options. Medication abortion only is available for people up to a certain amount of weeks. And every state actually has a different law of, is medication allowed to be mailed to you? Do you have to go to a center in order to get it, right? Like that also changes. Medication abortion isn't necessarily like just like calling your doctor, getting a prescription and picking it up at CVS all the time, right? And so I think there's a lot of misinformation about medication abortion. It's like the ability to access medication abortion. And I think it also assumes that people know when they're pregnant early in their pregnancy. Not everybody realizes that they're pregnant early in their pregnancy. There are many stories of people who don't realize that they're pregnant until maybe they're 8 or 10 weeks, because they've always had irregular periods. They've always missed, it's not abnormal for them to skip a couple of months. And so, with medication abortion only being available to a certain amount of weeks, after those weeks pass, that's not an option for you anymore, right? And then in-clinic procedures are the only option for you. So I think that this question also lends itself to, how are we talking about abortion? How are we educated on what is available to us, what is not available to us, and also assuming that medication abortion is an accessible option. When, just like in clinic procedures, you might have to go to the health center to pick it up. Do you have a car? Do you have to take off work? It does cost money. Do you have the money, right? Do you have health insurance? And so I think that our roles in just this fight in general is getting a firmer grasp of what is kind of, again, legally allowed in our particular state. And then the question I always ask, or the thing I always say to my students whenever we have difficult conversations is, okay, but I want us to go deeper, right? Like, what's the next level? What's the next thing that could impact this? Let's think a little bit more critically about this particular issue, right? So when people are like, oh, medication abortion is an option for me, you're like, I'm so glad that that's an option for you. And not everyone has the same identities as you, or not everyone has the same access as you. So let's go a little bit deeper. And how do we make sure that abortion is accessible for everybody, regardless of who they are in their circumstances? Thank you for that question, Judy. Any other questions or thoughts? Like, how are people feeling? Like, we're human beings. I like to say to my students too, that we're just like, we're plants with complex emotions. Like, we need food, water, and sunlight, and then we have a lot of emotions. So we're complex plants. So what are, Ethel, I see your hand up.
Yeah, you touched on it a little bit in terms of the legal. I've had some idea lately trying to approach some of the attorneys, and if you, in the states like Ohio now, where you really can't access anymore, and you end up having your baby, I think we ought to start thinking in terms of being able to sue the state for support through the child's age of 18. Let's let them feel that in those states like Texas, Oklahoma now, that it's going to cost them, and make them understand that there is a price to having children, and not everybody can afford it, etc. It may be a long-term thing, but I think it's something we really have to think about.
And I think that what you're raising is that there are many people have abortions for many reasons, and every reason is valid. And what I think is the reason why, from a destigmatizing abortion lens, like, how do we talk about our issues without unintentionally contributing to that? We don't call folks pro-choice anymore, right? Or I'm sorry, pro-choice and pro-life, right? We don't want to kind of do that. We want people to kind of be in their complexities and say, how they're feeling about that individual, decision for themselves is for themselves, and putting people into pro-choice, pro-life boxes is not kind of helpful for this conversation, particularly because folks who say that they're pro-life, what they're actually saying is that they're anti-abortion, right? Because for many people choose to have abortions because they are pro-life for themselves. They want to make sure that they are able to care for the children that they have in their fullest capacity. They don't want to have children. They're not ready to have children. And that is all about, how do I make a decision for my life? So I'm pro-life for myself in my choice to have abortion. And the folks who potentially call themselves pro-life, when we call them anti-abortion, it's because, Ethel, kind of what you're referring to is what happens after a child is born. Where's the additional support, right? Where are the policies that require, for example, this is hypothetical, right? I'm just going to make it very, very clear that this is just kind of like me spitballing. What about access to universal childcare or universal pre-K, childcare access within high school, so that young people who happen to get pregnant and choose to continue with their pregnancy, that they don't have to stop going to school, right? And so what does the future for that person look like so they can raise the family that they want in a safe environment, which is one of the tenets of reproductive justice. Whilst Planned Parenthood is not a reproductive justice organization, we're a reproductive health and rights organization. A lot of the advocacy that we do is with a reproductive justice or reproductive freedom lens. The 4 tenets of reproductive justice that, reproductive justice being a framework that was made for and by Black women specifically, and folks of color, because they realized that the traditional kind of pro-choice, second wave feminism was not including them, right? And so it's more than just access to abortion, right? It's the decision whether to not have a child. It's the decision to be able to have, like, I deserve the right to have a child. I deserve the right to raise my child in an environment free of violence, and I have the right to body autonomy, right? So, so what does all of that mean? And what does access to abortion and access to reproductive health care as a whole, access to healthy water, access to affordable housing, access to clean air, what do all those things mean for people's reproductive futures and their ability to raise the families that they want?
Yeah, but I think it's important in states like Ohio and Texas and the rest of them to understand, the legislators have to start understanding that it has to cost money, and their idea of being pro-life has to include raising that child and paying for it. And I think it's important for legislators to start realizing that it's going to cost them money, and because that's what they understand. And so anyway, I think it's something we have to start, really talking about. New York is not like the rest of us. I mean, anyway,
and you're right. And this is something that we did a film screening earlier in April, and we were talking. We screened a documentary about one of the last standing abortion clinics on the state line of Texas, so a border town. And something that we were in our discussion, I had said, I was like, I really want to be mindful that I'm not perpetuating this like them versus us dichotomy. Like, Texas is not like New York, right? Like, we're so great. Yes, our policies our policies are different, and people have a hard time accessing abortion in New York. It just looks different than places like Texas or Ohio. And what is our collective responsibility to support people regardless of where they live, in order to make the decisions for themselves, and the decisions that they need to make the, to get the care that they need for their bodies, regardless of what that care looks like, regardless of what decision they make. What is our responsibility as a whole to be like, I'm from New York and you're from Ohio, but we are in this fight together because we know it's much bigger than just state by state, right? This is about all of us.
Yeah, well, you mentioned something, childcare in high school. I went to Taft High School in the Bronx way back. And I understand that nowadays they do have a daycare center in the high school. I don't know if that's true in other high schools, but that's something that has to be considered all over to allow a young woman to finish school. So
I'll leave you with one final statistic. If Roe v. Wade were to be overturned, it is close. I think the number, I'm not going to do like specific number because it's a really big number, but I will tell you it is close to 26 million people of reproductive age will lose access to abortion care, period. It's a lot of people, right? And that's women, people who have ability to get pregnant who don't identify as women, so trans men, queer people, right? People are going to lose access to care, and that is a big number. That is a very, very big number. And so I do want to quickly talk about kind of next steps and what people can do, just in case folks need to jump off. And I'm going to throw the links into the chat after I'm done talking about it. So I think that Jayshree's time with us before she has to jump off, I think her story really shows how impactful it is for us to share our personal experiences around sexual and reproductive health care, or just in general in the things that are important to us. And so we host a storytelling training very often about how to write your story, but then a lot of the questions that we get from people is like, okay, I know how to write my story, but how do I get it out into the world and get people to listen? So we're having a storytelling and action training with a guest speaker. Her name is Eve McDavid. She is one of our activists, and she is incredible. She's a Google strategist, and she's a cervical cancer survivor. She was diagnosed with cervical cancer when she was 35 weeks pregnant with her child during the pandemic. So we're gonna like add all the stuff onto that experience, right? And so she has been able to share her story on various platforms, ABC, the World Health Organization, Insider News, to raise awareness about cervical cancer, specifically cervical cancer that comes from HPV, and the importance of educating people on HPV screenings and, and the care that they need. So Eve is going to come and do a training with us and share her knowledge and her wisdom of how she was able to share her story so effectively and get people to listen about how important it is to raise awareness about the issues that are important to us. So I will throw that RSVP link in the chat in just a moment. As mentioned earlier, we are traveling to Albany on May 10th for the Equality Amendment rally and some lobbying. This is the first time we're like taking a bus trip since the pandemic, so it's very exciting. And so that is going to be on Tuesday, May 10th. It is all day. We will have a bus stop from Suffolk County, as well as we're sharing our Long Island bus with the folks at Planned Parenthood of Greater New York. So there'll be a Suffolk stop, there'll be a Nassau stop, and then there'll be a bus from Westchester as well. And that is free bus transportation. You just need to RSVP and let us know which stop you'll be coming in. We are still kind of in a pandemic. We like to remind people of that. So we will be requiring people to wear a mask on the bus trip to and from Albany. And we will also be asking for proof of vaccination or proof of a negative COVID test within 48 hours to make sure that we are still being mindful about people's health. We are also asking people to get prepared for the Supreme Court decision to come down, which we're anticipating happening in June. Sometimes the biggest impact that we can make is just showing up in mass. And so we're asking folks if they are interested in being what we're calling a rapid response volunteer, which essentially means once the decision comes down, you are committing to showing up at some sort of demonstration that's going to be organized shortly after. It's hard to say when that's going to be because we don't know when the decision is coming down. So please just let us know if you are interested in getting information about where you can mobilize after the decision is made. And then Planned Parenthood Hudson-Peconic knows that access to abortion care isn't just about getting to an appointment and having their procedure or having their care, but it's also afterwards, care pre, during, and post the actual care. And sometimes people are not able to access the things that they need to experience their abortion with dignity. And so we are starting an abortion aftercare kit project. We are asking folks to donate items so they can make these compassionate abortion care kits accessible to everybody who comes to Planned Parenthood Hudson-Peconic for abortion. If you remember in the previous slides, last year Planned Parenthood provided over 8,000 abortions. So like this is like a really ambitious project. So we're starting off a little bit small, but the aftercare kits will include both practical things like menstrual pads for clotting, the pads that can go on your mattress so that, I don't know about anybody who experiences this. As someone who menstruates, it is like the worst feeling in the world when I wake up in the middle of the night and I'd be like, have to change my sheets. So providing things that can protect your mattress if you do clot in the evening, heating pads for crampings, granola bars for like sustenance. So like very, very practical things, but also things that are about, that compassionate personal part, right? So we were going to have a zine or a magazine, a small magazine that our amazing intern put together that has, shared stories and resources and things to make people feel not so alone if that is what they're experiencing. We've got cozy socks and we've got coloring pages for meditation, right? So both practical and very much so this like human component, so that people can kind of pick and choose what they need. Some people are super confident in their abortion decision and they're like, I don't need this self-care stuff, but I'll take the granola bar. And some people are, sometimes abortion decisions are isolating for folks if they feel like they can't share their experience with others. And so we wanted to make sure that people know that they are not alone, that abortion care is something that 1 in 4 women or people who are able to get pregnant will experience in their lifetime, and they're not alone. So if you are able to donate items, I'll throw a link in there where you can purchase things to donate. If you're unable to financially donate, don't worry, we're going to have packing events. So if you can't financially support at this time, when we do have all of our items together, we're going to get a ton of volunteers together to put these abortion kits together. So there's definitely ways for people to get involved. And that is the end of my presentation. I'm going to throw all of those links into the chat.
Thank you.
Also make sure that people have have them for any kind of like follow-up email that happens. I'm happy to do that as well.
Thank you very much, Lauren. This was very informative. There's plenty to think about, and I'm sure we can continue this conversation because obviously things are unfolding as we speak. And we can continue this conversation on Facebook. You can go to the Suffolk Facebook page, and it'll be nice to have an engagement continuing over there. So thanks a lot, Lauren, for making the time to be with us today. And who knows, we'll have to come back again.
Yes,
so...
we are going to do our best to make sure that we keep everybody in the loop, especially when the Supreme Court decision comes down. It's going to take us a minute to take our the nationals kind of legal team to actually understand what the decision means, because it can be a little bit nuanced. But as soon as we know what's happening, we will make sure all of our supporters know what's happening and how